Hello, it's Dr. David Hornbrook here at Keating Dental Arts with our weekly podcast entitled Dental Up. And for those that have listened in the past, we named our site and just our whole media avenues Dental Up because we want you to dental up. Man up, cowboy up, step up, whatever it is. We want you to take your dentistry to an entirely different level. I have a special guest today, and special because he's been one of my very best friends for almost 20 years, if not more. And so we're going to have fun today, and I would like to welcome Dr. Mark Montgomery. Hey, Mark.
Hey, how are you doing, David?
Really
it's nice
good.
to be here.
Oh, it's good to have you here. And, we've done interviews together, and some of them are serious, sometimes not. I know you've heard this before, but certainly our listeners probably have not. You're definitely my mentor when it comes to what I'll call functional dentistry. I graduated from dental school not knowing anything about occlusion or the things that
We all did.
know. Yeah, it wasn't practical. Of course, everyone else was saying, yeah, me too. My articulator became this really great doorstop. The more aesthetic cases I started doing, the more failures I had, and so I had to go back and revisit the functional aspect of how to make my beautiful dentistry last. And you were my avenue, very non-dogmatic, very practical. You practicing dentistry yourself, and so I want to thank you for that because you changed my life in those regards and in just an amazingly positive way.
Thank you so much. That's nice for you to say.
And it's nice to have you here, and I'm honored. So, we had dinner last night, and we've had some you always have deep intellectual conversations. I just kind of listen and ask questions and kind of sound deep, but I'm never there, and I always sound so stupid and very unwell read when I'm around you. But, we had dinner last night, and like a lot of dinners we've had, we contemplate, what's going on in dentistry and where people, these young men and women, and actually young, both older and middle-aged young men dentists that may be struggling in their career. And so I was thinking, do we start at a certain place today, or where do we start in our conversation? So I'm going to ask you one question. I want you to be very frank. You have the opportunity to say whatever you want here. You've taught aesthetics. You started with really a functional aspect, whether it be TMD, whether it be how to take bites, where these cases should be mounted. Then you taught with T-scan and bioresearch with equilibration and really understanding that. You got into aesthetics. Now you're into pain control. You've taught ortho. You've placed implants. So you've done everything, and you've also educated and worked with dentists of all demographics in all these avenues. If I had to ask you a question, do you think the average dentist, whether we went here in Orange County or we went up to Salem, Oregon, where you're from, are they capable of treating their patients the way their patients need to be treated? Do they have the skills?
Wow, that's a great question because I'm not sure there is any such thing as the average dentist. I think every dentist brings a unique skill set to the table, a unique relationship with their patients, a unique mindset about where they fit in the healthcare system and where they fit in the health of their patients. So I'm not sure there is an average dentist, but I will say this. I think that any dentist who wants to dental up, as you said,
Right.
or step up,
Right.
I think there are phenomenal resources out there that every dentist can access the type of information and the type of skills that they need to take care of their patients. Absolutely. I think that that's available to them.
Okay, so that's available, and I totally agree, right? I mean, you look at where you are today versus 20 years ago, and where I am today versus 20 years ago. I'm a different person as a dentist. Patient comes in today, I think they're getting better care from me than, don't tell them that, but 20 years ago, because I have a different skill set based on experience and learning from people such as yourself. So a young graduate from dental school, and you've had the opportunity to work in a lot of dental schools. I'm on faculty, adjunct faculty at many dental schools. Right. Young dentist gets out and they just spend $500,000 in 4 years learning to be a quote unquote dentist. What do you think, if they had to look at this big global world of dentistry, where should they be looking for? I mean, what should they be looking for? Where are they most inadequately prepared to meet the needs of John Smith that walks into that practice?
Wow. I think probably the biggest inadequacy in dentists coming out of dental school is that they have learned so much about how to learn. They've learned how to perform. They've learned how to create a step-by-step process. But I'm going to give you two things I think that they really need. And number one is, without a doubt, the ability to create good systems in their practice so that they can deliver a consistent, predictable quality of care for their patients. And that developing a system is a field into itself, really. But we start in dental school, we're given these huge charts, and we have this huge background, and we go through this comprehensive oral diagnosis process and taking all these radiographs, and now there's even more imaging available, whether it be photography or digital scanning or 3D CT scans and 3D cephalometrics. There's so many systems that are out there for those kinds of things. But how do you take all of those things that are possible and integrate that into a diagnostic system that makes sense on a daily basis? And I think you've heard me say before that one of the problems is with being a comprehensive dentist or wanting to be a complete dentist is that you can't examine every patient for everything every time they come in. You have to have a system in place that says, I'm going to screen and examine and treat in a way that meets my patient's needs and meets their where they are in their life.
Yeah, and I think, I'm going to interrupt here, I think the last thing you said, and then expound upon it, is, needs and desires are two totally different things. So we get out of dental school, and it's all about needs. You don't like the cap on your front tooth or the crown on your front tooth. Well, first you got to have your blood drawn. Then we have to do a medical screening. Then you have to go through 4 quadrants of root planing and scaling. Then we have to fix that amalgam with the fracture. And 8 weeks down the road, and I think dentists do this in their practice, finally the patient either gets frustrated and goes to another dentist that'll fix their crown or whatever it is, or they'll be unhappy for those 8 to 10 or 12 or 16 weeks, losing sight of, the dentist loses sight, I think, of why did that patient come visit you in the first place?
Right.
And so I think systems, and you teach systems, I teach systems, you need to start with A and don't skip, P, Q, and R, and then go to Z, but there needs to be some deviation. And I think people struggle, and when can you deviate a little bit to keep your patient motivated?
Sure.
So what advice would you have for someone that's kind of maybe stuck in a set of systems or a lack of a set of systems that want to either be happier or more successful or more proficient or efficient in practice?
I think in a sense, there are 2 different kinds of ways of practicing dentistry. Well, let me say this. I think there are 3 things that we treat in dentistry. We treat symptoms, we treat diseases, and we treat patients' quality of life. And when we spend our time focusing only on symptoms, we become more of a reactionary kind of dentist. And there's nothing wrong with that. And what you're saying is a patient has a broken tooth and they need a crown or a restoration of some sort right away. And that's symptom driven, that's need driven, and it's an integral part of what we do in dentistry. And then there's the level of what I would call the disease-focused dentistry that we do, where we focus on diseases and disabilities and destruction, where we go in and we say, okay, we've got all these different things going on in all the teeth, and we start to focus on does this patient have rampant caries, or does this patient have periodontal disease in their whole mouth, not just one abscess. So now we're focusing on the disease process, and that plays an integral part in dentistry as well. And then the third level is the patient's quality of life. And there are patients who, when we sit down and have a conversation with them, they want to have a relational kind of dentist, not so much a reactionary dentist only. I mean, yes, we have to do that crown that needs to be done, but they also want to have the kind of relationship where they say, are you going to take good care of me for a long time? And I call that more relationship-based dentistry or quality of life dentistry. And every patient fits in that spectrum somewhere, and every dentist fits in that spectrum. And the real key is, do we have the personal systems in place to do it? And do we have the personal leadership in place that will allow us to take our patients and our team to a place of increasing their quality of life? I don't know if that answers
it
absolutely.
Absolutely answered my question. I think it makes certainly myself and our listeners think about what are they doing for a living? You know, what are you doing for a living? You know, if I talk to my relatives, they say, "Oh, did you pull some teeth today?" It's like, I haven't pulled teeth in 28 years. I mean, if that's what they really think that I do for a living, you know, I haven't communicated properly with the way I talk about my profession. So I think that's, you know, if dentists know what they're doing for a living and why. You know, you're big about the why and why they're doing what they're doing and why they're making the decisions that they are. So, are you a Ducks fan?
Well, you mean the Anaheim Ducks?
No,
or
not the Anaheim
Oregon
Ducks. Yeah, the Oregon Ducks coming from Salem. Are you a Ducks fan?
So the reality is I'm not really a Ducks fan when I'm in Oregon because I'm an Oregon State Beavers fan.
Oh,
And
okay.
so,
So that's a little difficult. Yeah.
You know, but outside the state, then I'm a Ducks fan.
Okay. So Marcus Mariota, how's he going to do as you go to the pro? You think he's going to?
I think he's actually going to do surprisingly well.
Yeah,
I really
do.
do. I
There's
think
naysayers, but I think he'll be a good.
Yeah, if he gets strong enough, and the good thing I think about Marcus Mariota is almost what we're just talking about. He is a good decision maker, and he thinks on his feet, and he reads the defense. And, you know, kind of tying that back into dentistry, that's what we need to do with our patients, is when our patients come in, we have to be able to read the defense. Do our patients, are they in a place where they really need us to sit down and become their dentist for the next 15 or 20 years? Or do they need us just to take care of this one thing right now so that they can get through until their next insurance year next year? And if you're Marcus Mariota, you're going to say, I need a first down. You know, I don't need to score a touchdown on this play.
Right, and the defenses are changing. If he went to the huddle and went to the line
Absolutely.
every single time doing the exact same thing he always does, I mean, he would either get sacked or throw an interception or no yardage. And, you know, I think it's a leadership skill set. You know, we haven't really talked a whole lot about skill set, but skill set and confidence, things that we've taught, so that you can sit down and have an intelligent communication with your patient and feel confident you can deliver. And that's the skill set. We're going to change a little bit here. So I'm real excited about some of the things you're going to do with Keating Dental Arts and me here at the Continuing Education Center. And, you know, we've shot videos together before, and we've done programs, you know, taking the correct bite and trying to get into, you know, functional dentistry that works. So you've come up with a whole new concept that you call the Montgomery Method.
Correct.
And to find out, is that montgomerymethod.com?
Yes.
Okay.
Montgomery Method.
So if you want to find some information. So how does that differ from Dr. Montgomery that knows how to place veneers, knows about dental bonding, likes this material, knows how to take a bite, how do you do a denture? What is that method?
Well, MontgomeryMethod.com goes together with those things that we just talked about. It's developing what's next for a dentist and why. I like to say now is the time to dream, to learn, and to choose. And so all of us have dreams, and all of us want to learn something more, and all of us hopefully are ready to choose what's next for ourselves and for our patients of our practice. And we have our own reasons for doing that. So when I meet with a dentist in the Montgomery Method, my goal is to help them sort out a strategic path forward for their leadership, for their systems. It may be skills. Maybe they need to develop some skills. Maybe, like Marcus Mariota, maybe they need to be able to run with, you know, instead of just passing every play. But as dentists, we have to increase our service. Some dentists want to increase their service mix. Some dentists want to just do more of what they already do. And so, you know, everybody needs to have somebody that they can rely on as a coach and a mentor. And I love spending time with dentists, talking shop. And it's a natural fit for me to help dentists build their leadership skills, build their systems in their practice. And there are so many different areas where, like you said, where dentists want to build those things. Mm-hmm. A good example is one of the big things in dentistry right now is sleep apnea, mm-hmm. and being able to help patients who have airway problems. So what kind of systems does the dentist want to build? Do they want to only do sleep apnea appliances for patients who are CPAP intolerant? Or do they want to know more about sleep? Do they want to know more about insomnia and obstructive sleep apnea and how that ties together with stress and cortisol and all those
Mm-hmm.
things that are more medically oriented, and how does that tie together with some of their chronic pain problems? Or is this a dentist who's interested in saying, I want to help prevent these problems in my patient population, and I want to know what to do with my pediatrics in dentistry? How do I help develop good arches and good airways for these patients as they're growing up? So there's a big, broad range
Right.
of ways to approach these issues. For me, it's a matter of helping a dentist say, you know, what I want to do is, and let's say that's, I want to know how to just put my toe in the water and start doing some basic sleep appliances
Right.
for my patients who have mild to moderate sleep apnea.
Yeah.
Well, we've developed great systems for doing that here at Keating and with our exam systems, and we have a way of making it easy for a dentist to, you know, get their feet wet. And then certainly there's a whole host of
Right.
knowledge out there. That
Yeah, it's almost overwhelming for some dentists, but I think you're right. I think that we as clinicians can dip our toes enough that we can help a lot of patients.
A lot.
You know, and we're in the prime place to see this early. I mean, we've all had patients where, you know, they say, "Oh, I can't breathe. And their nose is wide open. It's like, what do you mean you can't just breathe through your nose? And so we're seeing them firsthand where physicians may not be able to even diagnose that or have that conversation. So,
and for me, it's very personal.
yes, that's right.
Because I'm a sleep apnea patient, and I have been for, you know, I started my sleep apnea journey in about 1998. My problem existed long before that, but, you know, I came to a place where I said, you know, I'm gaining weight, I'm becoming more sedentary, and now I'm having these problems with my sleep. And I went to the doctor, and he said, well, I did a sleep study, and, well, you have sleep apnea, and you need to, you know, get on the CPAP machine. I said, well, if I lose weight, can't I just get off of that? And he laughed at me. He said, you're not going to lose weight. I said, what do you mean? He said, as long as you have sleep apnea, you will not have the energy to do it, and you will not have the metabolism that lets you lose weight.
Yeah.
And it's taken me years to really understand how personally how I have to be really committed to my own health.
Right.
And so that helps me want to lead my patients forward in taking care of their own health as well.
Yeah, that's awesome when we can take our personal experience and again, sleep apnea and use of the CPAP and the inconveniences of going through all that, or the lack of personal health, right, or appearance, not in your case, but you look in the mirror and you're heavier than you'd like to be, and think, you know, what am I going to do? Am I going to exercise? Well, you wake up in the morning and thinking you're going to wake up and go to the gym, and it's 6 o'clock and you push the snooze button 20 times and you don't go to the gym because there's not energy. And so I think there's so much misdiagnosis and undiagnosis of that.
Right.
So, you know, one of the things we're going to do here with you, because that's not my expertise, sleep apnea is not my expertise. Insomnia is, but it's only because my mind is going a million miles a minute. So sleep to me is totally overrated. But that's, you know, as the saying goes,
you can sleep.
I'm going to sleep when I die. It's like there's nothing else I can do, so that's what I'm going to do at that time. But that's not my area of expertise. And I know a lot of clinicians that, you know, even in my programs will ask me about it. I say, I'm not the one. And so we're going to have an intro to sleep apnea, which, and I think courses like that are cool because at that point a dentist can make a decision. Do I want to get an in-office sleep machine and to have my patient take that home and really get into this and understand how to read, you know, scans, or do I want to just help these patients that are snoring and their quality of life and, you know, and maybe improve the quality of life for them?
And that's my goal, is to say, if we're going to come and do an introductory program, let's at least have a basic system that we can put in place and see if you love doing this.
Yeah.
And if it's something that is predictable and profitable and improves your patient's quality of life, then that opens up the floodgates for other dentistry.
Yeah,
And
I totally agree.
So that's
and it is something that a lot of dentists aren't doing. So it's a new service in your practice.
right.
And once you learn about it, you realize a whole bunch of my patients need some help right in the future. So
Right.
we'll let's end on a couple things. You know, again, you have a zillion people that come to you every day and ask you questions, whether it be email, whether it be lectures, whether it be phone calls. So if you had to say, okay, these are the three most common questions that I have to address from dentists. I mean, what are they? I know I kind of put you on the spot.
Well, I'll tell you what I can tell you for sure. The number one question I get is, this case looks really complicated. Where do I start?
Mm-hmm.
And that is the, I think that's the place where it shows that we really need to have an approach at the very beginning of care that lets us not only know our patients but ourselves, so we can say, this is where I'm going to start on this case. And that's one of the things that you and I have developed over the years, is a really, really great system for saying, where do we start this case? Whether it's aesthetically or functionally, or a vertical dimension case, or a wear case, or a pain case, where do we start this case? And once we start it, how do we get a patient through the process and still do the right thing for them?
Yeah.
And so that's probably the second question I get is, how do you do all this big comprehensive dentistry on patients when it costs so much money? And you know, so that's the second question I get, is how can patients afford this care?
Yeah, and next week we're going to be interviewing Dee Dee Reed, which I know you work with, which is going to, I'm going to ask her some of those important questions, because I think the average doctor would say, oh yeah, I have all these full mouth rehabs in my office, but no one can afford $30 or $40 or $50 or $60,000.
Right.
Yet there's someone down the street that's doing it because they have communication skills or they've created value. So I'm looking forward to that interview.
Right.
You know, to plug us a little bit with what you just said, you know, you and I have been doing the functional aesthetics series. It's a 3-part series, 2.5 days, very affordable here at Keating Dental Arts, and that's opened, I think, the eyes. And this isn't me tooting our horn, but just the feedback that I'm getting is opened my eyes to these doctors saying, wow, I can either do this, or I can make right decisions, or win to punt.
Yeah.
Right. And there's times you look at some cases and you think, you know, this is not a case I want to challenge, or I want to transfer them to someone that can treat their pain or the pain aspect.
Yeah.
Then I'll do restorative.
Yeah. And that leads me exactly into what I would say is the third question I get asked, which is, where should I go to study occlusion? And I think, and you know, again, what you just said, there's no better place to learn occlusion than when it's integrated with the aesthetics of the restorative dentistry and the aesthetics of the smile. As you well know, I'm a big fan of talking to patients about their smiling and their chewing. And so when I think about occlusion, it's not just some sort of erudite dots on a teeth jaw position thing. It's, does my patient have a stable, functional chewing system that's going to support their health and their beauty long term? Yeah. So those I would say those are the 3 questions I get asked most.
Cool. And you have a lot of questions you have a lot of answers, I know, which are always good. You know, one thing I really enjoy about listening to you talk to people is you make them think. They'll ask you a question and you'll ask a question back. And I think that's important, because people should be able to think for themselves a little bit, or wonder what their why is. You know, why are they asking that question, and how can they come to a solution themselves? So we're going to go ahead and wrap up. This is always fun. We'll do it again. A couple websites I want people to check out is obviously keatingdentalarts.com/media. We have a lot of videos. Mark is just did some videos. Dee Dee Reed, who I mentioned, is going to do some for us. I have several videos that are available on that, as well as podcasts of the past and the future, so we'll catalog that. And then be sure to check out your website, Montgomery, and that's Montgomery, MontgomeryMethod.com, because you're traveling all around and you have a wealth of knowledge. So I appreciate it.
Thanks, man.
All right,
it's been fun to visit with you.
Yeah, thanks.